We're going now.
Good afternoon. This is Bruce Harold. I want to thank you all for attending. Over the next several weeks, we'll provide our detailed plans for reopening this fall. And today, Rod Lennertz and I will cover the broad issues and the overall plans. Then over the next 4 weeks, we'll dive into several other sessions. Each of these sessions we'll do twice a week to make sure we pick up as many of our community members as possible. The first session next week will be on academics and classroom experience. The next week we'll focus on the student experience, which will cover obviously our residence halls, dining complex, as well as activities and clubs. HR support will be the third. And then last but not least, and very importantly, will be our research efforts of bringing that back to life. In each case, we will try to discuss the advice we've been getting from a very important team in our community, the Crisis Intervention Management Team, about how to think about reopening. And in each case, we'll also try to take that advice and say how we're applying it and what the specifics are in each area across the institution. As we start this, if you don't mind, I'd like to just start with a few overall observations. And perhaps the most important is to thank each of you. This has been a long journey. We've discovered with all of your help, we were able to shut down the campus quite quickly. And faculty, I've been amazed at how you've converted so quickly to online education, and staff, the moving, if you will, to remote settings and continuing to keep the university fully functioning as far as I can see throughout this very stressful period. Of course, UIHC, all our healthcare workers on the front line, day in, day out, 24/7. I talked to many of you on early Sunday mornings or late on Saturday nights. Thank you. State Hygienics Lab, you went from one shift and a few hundred tests a day to 2 shifts to 3 shifts, and you're still at it. We couldn't have gotten through it without all of your support. Students, I've talked to a lot of students. I think they've all said that they figure out how to get themselves through the online experience, but they really miss the residentialness of our campus and the community. So I want to thank you for tolerating all the things we've taken you through over the last several weeks. Our Board of Regents, thank you. You can't begin to express to all the others, non-Board of Regents members, how often we've had to talk, how rapidly their conversations were, particularly as we're thinking about shutting things down and bringing people back from all sorts of countries around the world. And then finally, and very importantly, our Crisis Incident Management Team, the CIMT. We very quickly moved into that mode. It's important during a crisis that our shared governance process, which sometimes, as we all know, importantly, is long and arduous and relatively slow. That's just not a way, I think, we learned several years ago during the flood, not the right way during a crisis to lead an institution. This Crisis Incident Management Team has met daily for several hours and have gone helping us think about how to close and now giving us really good advice, which you'll hear, on how to reopen. So thank you to all of you. Secondly, I'd like to go on and touch more on this issue of people in our community. I'm very mindful of Sandy Boyd's comments many years ago. We've all, I suspect, heard it at least once, if not many times, that when he closes his eyes, he sees and thinks about the University of Iowa, he sees people. And I think that's absolutely true. I would just like to say, as I've been closing my eyes over the last several months, I actually see one huge team. I see those people coming together in a way that's just almost unimaginable to deal with the CV-19 virus, the fiscal issues we're now starting to experience a number of those decisions, the social unrest that's going on across not only our community, but across the country, and the list goes on and on. And in every case, we've come together. We've come together to argue, to debate, to solve problems, and to constructively find creative ways to get through each of these periods. So I'd like to segue to the issue of it has been really, really, really hard for most of us on thinking about how to reopen. Closing is something, you just almost flip the switch. Reopening, there's no switch. There's so many different variables. And we'll talk through those variables over the next several weeks. I mean, there are issues of distancing in the classroom, distancing out of the classroom, how big class sizes should be, protective masks, classroom protocols, online versus face-to-face education, testing, self-isolation when people are found to be positive. And every one of those is not a clear answer. And every one of those deserves a very rigorous, spirited fact-finding and debate, and then decisions. And we'll take you through them. But I'll also say that further really complicating, at least to me, our work has been watching a lot of our peers. They've made a lot of announcements. And again, this is just me. I know we pride ourselves on teaching students how to think critically. We say that's one of our most important jobs. And it's not just the specific subjects, but there's a process to think about. When you hear me talk, you're thinking, all of you, thinking about what's the evidence and how truthful is it and how accurate is it. And then we also go through the process of collecting data and exploring possible options and go through a very specific, rigorous process of thinking and deciding things critically. And unfortunately, again, only in my opinion, I think many of our peers have not done that very well. I think they've, as it relates to reopening, instead they seem to be moving like lemmings. And just because one university does something, it must be okay, because they clearly must have thought through it pretty well. And so then a second institution picks it up and does something similar. Well, the one thing I've really learned from a lot of our professionals on the CIMT during this period is this virus is not the same coast to coast. It's not even the same in Iowa. Iowa does not have one pattern. And I think one of the smart things Iowa did is broke up Iowa into different regions and started to think about them differently within each region. So we purposely have not taken the approach that just because one institution decided to go online for the entire year, we didn't emulate that. We didn't decide that our calendar should be just the same as other institutions. We specifically got people together and empowered a group of these experts from across our campus to work through every nuance and specifically address how the University of Iowa should reopen. Not the entire regential system, not the privates in Iowa, not Notre Dame, not Purdue, not Iowa, Indiana, but Iowa. And so you'll hear the details of those considerations over the next several weeks. And I once again like to really, really, really thank everyone who's worked on this. Several weeks ago in a DI interview, one of the interviewers asked me how I was handling this. And I admitted that at the outset, I was really, really struggling. And one evening, I remember sitting back and saying, look, what is the one objective? What's the one principle we should be using, or I should be using, to guide me through this? This was in the March time period. And it was pretty easy once I started thinking about that way, because to me, the issue is keeping all of us safe. And when you start thinking about it with that, you could say money is important, keeping everybody in job, but the issue of keeping us healthy seemed to be absolutely the most important consideration. Our students, our faculty, our staff, everybody, even our broader community, because we're such a large portion of it. And part of that then started leading to some of the principles of UIHC and how they needed to operate and what they needed to do. As many of you know, we shut much of the hospital down. We took huge fiscal hits by shutting down elective surgeries as well as some of the clinics. We decided to keep all of our employees in pay status but at home, and get them off the campus for their own safety. So that is also, I believe, the right way to think about reopening. That safety needs to be our primary objectives. We need to get back to instructing our students, and I think we can safely. So it's not an either or. Oh, you can't open safely. No, I think we can. There are a lot of examples of institutions who are taking a lot of care and going through a lot of details of how they reopen safely. I think we must get back to our research. I hear a lot of our faculty and major research community screaming, let me back, get me back into the lab. And we are, and we're having a staging process, but we're staging it so that we can do it safely. We can train them, we can put wherever we need to, we can put in protective equipment, and we can set up procedures and policies to reopen research safely. We must get back to running our residence hall. Our students are screaming, wanting to come back, but we need to we're going to really need their help, because they're going to, not only all of us, but all of them are also going to need to change their behavior so that we can actually reopen the residence halls and dining and all the activities and clubs safely. I actually believe in our midst is a great example. UIC, they've been on the front lines, but they created separate pathways. They've gone through a lot of protective equipment, and they've done so safely. They've treated patients safely with CV-19 in their midst. So we're now going to have to do several things at once. I think we can, because I think we have the professional skills, and we actually, I think, have a team that really wants to get back to work, wants to get back to education, wants to get back to the research. But we're going to have to all change, and we're also all going to have to conform. And please understand, if any of us have some condition that makes it really not a smart thing to do to come back, see your HR team. We'll go through that. See your local HR representative, because we will make accommodations to keep you individually safe. And finally, I would just say, keep your sense of humor and stay flexible. Whatever we think we know right now will probably be updated in the next 24 and 48 hours. It's a very fluid situation. We are, in fact, seeing some degree of increased positive tests, largely with the younger generation, even in Iowa, not just nationally. So what we say about open in the next few sessions are our current, right now, as of then, that date, best understandings about what to do. But please understand that let's all stay connected, because things will certainly change as we learn more. And let's be careful not to I find at times we're looking for simple answers to exceedingly complex problems. Let's approach them as we know how to, critically, and tear them apart and understand each component. So thank you once again for all that you've done. Let us start now moving through this. Rod, let me turn it to you.
Thank you, Bruce. Great comments that help all of us to understand the base of the challenge we have in front of us. We are not, by doing these presentations, we are not at the end of this game. The CIMT and the university as a whole continue to work toward what is no doubt an unpredictable future. It is for all of higher education. And as you said, I think us working together as a team is the key component in the success of the University of Iowa coming through this summer and into the fall of 2020. And the one thing that I will reiterate is thanks for all of the people that I've had the pleasure and honor of working with on the CIMT, but also for all of you who maybe haven't had the ease of being in those rooms when the discussions are occurring and are trying to live with a very different way of existing, either in the labs, in the class, in your office. Your perseverance, your patience is very appreciated. Now, what I'm going to go through a PowerPoint presentation, which Ben Held has put up. I'll walk us through what is, in a sense, an introduction to what will be 10 fora events, or 10 of these, another one tomorrow, and then at the end of this presentation, I'll summarize the other subjects or chapters of our various fora that we'll be providing to help keep our university community informed. So let's get started with the PowerPoint presentation. Some of on the first slide, in our steps forward for the fall of 2020, We have, and these are the subjects that I will be covering in the PowerPoint, some basic principles that we in the CIMT have lived by from the very beginning. A moment for us to look back and look at some history to put in context what we're going through, actions to date. And then I'll go through a fall 2020 overview and some common questions. One thing to note, this is an opportunity for all of you to listen in, look in, and then opportunities for you to feed back questions. Each of these forum events that we will have will build on each other and build from the questions or comments that you may have. So there are some we start with that are common questions, and we'll cover those. And then I'll cover, as I said, the upcoming forum events. Starting with the principles on the next slide. They are four that we have considered central to all of our planning, and they start with, as Bruce started with, the importance of our people. And it's always going to be what we consider most important as we work through the different challenges and opportunities on our campus. People, as it says, our campus is only as strong as our students, faculty, and staff. And as Bruce referenced Sandy Boyd's words about our people, they are our most important asset here. Preserving and building on the core of our values: excellence, learning, community, diversity, integrity, respect, and responsibility. Maybe tucked into the middle of that is in urging by me, and I think of others, in what is truly one of the most unique and challenging times for us in the greater society with the things that we're facing, to be kind to one another, to look after the respect we carry for each other, and understand that each person you interact with is probably dealing with a set of challenges and a set of difficulties that may not be on the surface, but in almost all of our cases these days are there. And so we ask everyone to please be sensitive to that and take that into the second of these principles. The third, and obvious, right? Delivering world-class education, research, and healthcare. It's what we do. It's what we're charged to do by the state of Iowa as the flagship for this state, and it is core to where we head in our future success. And then finally, how we do that in engaging shared governance and campus leadership. We have always been touted as a strong university with respect to shared governance and for the four corners of an institution being heard. And that has been a process, actually an organizational process based on CIMT's makeup. And I'll describe some of that as we go. The next slide that you see is based on history. And it's one to just sort of remember and put into place and think about. Since our founding nearly 175 years ago. The Civil War, 2 world wars, the Spanish flu, many of us taking some parallel experiences from, or at least in reading, what we learned from what happened here on the University of Iowa campus in Iowa City and across the nation and the world with the Spanish flu epidemic in 1918. A Great Depression, a Great Recession, and multiple floods. One of those, or the most noted, of course, 2008. I just this morning had a chance to visit in a Zoom format with 120 different institutions of higher education throughout the nation, North America, with several breakout meetings. And many are frankly looking at us. We're already known as the university that has dealt with disaster. And I think it gave us a good head start. Every disaster is different, but we hit the ground running, and we're an action-oriented university who doesn't wait for others to help us. And I think that taught us important lessons. It actually allowed us to have something like a CIMT ready to roll when February came and this new news of a COVID virus was hitting the United States. So those are all interesting and challenging moments in our university's history. And the next slide, as it says, out of disaster, we have become better. One of those that isn't listed that I'll also mention that I often, when I'm giving campus tours, talk about, a little disaster, but a very meaningful one. We nearly lost the old Capitol in 2001 with a fire that devastated the building and the cupola and dome. While it was closed for almost 6 years, what we persevered from that one instance was an old Capitol that is more meaningful and better than it ever was. Same with the other disasters that we have taken on and worked through. Some examples, as you can see, the State Hygienic Laboratory, the College of Public Health on our campus, the Iowa Flood Center, touted both nationally and internationally, and a reimagined arts campus, all because of that flood of 2008. We recovered this campus more quickly than any similar examples nationwide, and no doubt we're a better, at least physically, a better campus. And I would argue that we also matured as a campus together as a team because of the 10 years that we fought through the recovery of that flood. This disaster, or this crisis, is nothing like the flood of 2008, but we still come together in the same ways. So what is next? If you go to the actions, the next slide, actions taken, I'll just go through a summary of some of the things, looking back, some of the issues that have come to take place since COVID became part of something that passed our lips every day. March and April, some of these items, of course, canceled study abroad first and repatriated or brought back students, faculty, and staff from all over the world. We began to look at and then execute the delivery of online instruction on our campus in a 2-week period that included spring break, and then also, of course, the bonus week of our preparation to get ready for the end of the spring semester, all online. We learned a great deal. It was not easy. Again, another thanks to so many of you and the IT team that stepped up and helped people and instructed people, but also for those who had never taken that step and took huge strides in changing the way class could be taught on our campus. We obviously changed to a work from home status at one point as we were establishing and looking at key access records. We were upwards of 85 to 90% of this campus working from home. Obviously, there were some campus critical functions that required people to stay here, but primarily an entire campus going home, working remotely, and not allowing the doors of the university to close. Our research went into hibernation, which is, for those of you especially in research, is incredibly impactful and difficult. It was a national crisis. Other universities in higher education facing that same strain. That happened as in the opening weeks. We canceled all non-emergency health procedures at the hospital, in effect emptying that hospital to be ready and able to take on anything that would confront us with respect to COVID. And then it says, stood up new supply chains for the university and the state. It was literally, we were hearing as Debbie Zumba, who began to alter her work clock to Beijing time because a lot of the supplies were coming from there, and the day-to-day challenges with contacts there to get what we would need on our campus became, in effect, almost a trade war across the entire globe as people were looking for materials and supplies at the same time. On the next slide, we move to May. In May, we had our first virtual commencement. It was difficult to swallow. It was hard for our students. We know graduating high school students were facing these challenges. Certainly our graduating students from the University of Iowa and other universities were facing this. But one of the things we did, as Iowans we do, we didn't take it as a moment of being a victim. We made what was really, I think, a remarkable effort by all of the deans doing video recordings, our leadership doing it, very special moments that we created for every student graduating. It was not the same, and it is not a replacement for being together, but great efforts on the first University of Iowa's first virtual commencement. We then, in May, requested of the governor hearing our statistics and our plea for action on this front, restarted non-emergency health procedures and the elective procedures at our hospital. That is still a challenge. People, even though, as I've heard Brooks Jackson state, probably the safest place to be is where we've got the procedures occurring in our hospital, because they're not in the same place where COVID is occurring, but all of the measures of safety are being made. And yet it's difficult for a general public in this sort of social science effort of this to go back toward a hospital. And so we continue to struggle through those efforts to re-ramp up non-emergency and elective procedures at the hospital. We secured and purchased the equipment and cleaning materials for the campus, and we initiated the first of 2 pilots to restart our campus through research in May with Vice President for Research Marty Schultz leading the way with many others in coordinating a phased approach to the return of research to our campus. June brought the continuation of that first pilot and the addition of a second pilot, athletics, and Gary Barta's efforts in timing with the Big Ten and with the NCAA actions and directions. The University of Iowa has begun that process of another pilot for us. Looking at the fall 2020 overview, and as the critical incident management team has moved forward, some structure and maybe some definition for you as we look at the critical incident management team. What is it? Who is it? We've talked some about it. As you can see in the first bullet, it's a UI term for equaling what is a federal term for emergency management, the incident command system structure, which is something that is born out of a federal agency program, Homeland Security, and as it says, Presidential Directive 5, and under the National Incident Management System, which is referred to as NIMS. Now, we became aware of NIMS and actually trained many of our administrators in NIMS, federal NIMS training after the flood and prior to our testing that flood critical incident management team in 2014. So they were common phrases, but no doubt Anna Lumpkin, who has recently joined the university as our emergency director, has and continues to guide us through that process and her role in working with the county and in working with the state to make sure that we're staying in lines with the protocols as we move forward. Some have asked, the team was assembled back as this COVID emergency began. It's often asked, pretty simple question. In our case, the critical incident management team was both appointed and activated by President Harold, and the team members then both being assigned and volunteering to do a great deal of work, working together each and every day with chief leadership for the different sections and many team members working on each of those sections. We continue to the next slide, some of the major topics, and this, it's often asked, where do I go for? And I think these are important go-to points for people to keep in mind, who to contact or sources for information. Obviously, the buildings, we have 250 of them on our campus to make a campus ready for 32,000 students and for all of the things that we're going to do on this campus coming into the fall. Makes July a very important month for facilities management to make those physical developments within the buildings work and be put in place so that we can have the safest possible place we can for our campus. Lynn Finn has been working hard with her entire team to get that ready. And as you can see, FM at your service becomes the great place, and the coordinators that you have, the building coordinators, a network of building coordinators for all of our buildings and all of our departments being reliable sources for information. And if you have questions or if you have information related to buildings that you want to make sure are passed along, FM at your service is really the place to go. The supply chain and protective equipment. Everybody has this high on their mind as we think about masks and cleaning supplies and others. Those will be, as Debbie Zumba, who is our AVP and Director of Building Services, has led this effort with many others helping her. The shared services units you have and personnel you have will be the primary contact for those kinds of questions and needs. And another people ask what will happen when we come back. Students come back, workers come back. A return to campus package, which includes face coverings and hand sanitizer, that has been and is being put together by Debbie and her team. Shared services, student life involved in that, so that we make sure that every student returning to the campus has a care package and something that will help them get off to the right step and right foot on a protective fall semester. And so we look forward to those being delivered as we go. Signage. Now there's a website for all of you to pay attention to. Coronavirus.uiowa.edu is our source, your source for the latest information and announcements we have. But if you go /communications materials, communication-materials, that's where you will see all of the information we have to move forward on a public facing and communications basis with signage that will be included on our campus as we move forward toward and into the fall semester. A lot of questions regarding vulnerable populations. On that front, it's a matter of contacting your dean or HR representative for faculty and staff. And for students, it would be the source of information and of support is the Student Disability Services Office. Meetings on campus. We are living in a different world, but as some have found, I certainly have, I thought as this would start, I would find more time on my calendar with less meetings. I've never had so many Zoom meetings or Skype meetings or whatever kind of meetings. Those are primarily the two that we work with. But that understand that as we are prioritizing classroom space, and because we're trying to keep all classes under 50 in a face-to-face environment, every classroom space, every space on campus will matter. And to that end, we are urging and directing that meetings should remain virtual, even if on campus. We'll keep the meetings virtual. So if you're in your cubicle or in your office or at home, you're able to plug in on an equal basis, but also not in one that occupies classroom space that the registrar and others may need for classroom space. If it was a meeting space. Questions that we have received, as I mentioned, when we go through these forum events, we want to make sure that we're responding to questions we receive, that we have a chance for people to ask questions, to raise either issues or concerns, and we can get to those. But we know some are common, and some of those we want to cover in the context of this introductory and more general basis presentation. One of those, why is the university going online after Thanksgiving? As part of our calendar, and Bruce alluded to this, we are holding to the calendar that we have for the beginning of the semester on August 24th through the remainder of our calendar, but we are planning on, as the Thanksgiving break goes, and comes by, we are going to a virtual online format at that point. The campus itself will remain open, and those who need to or have to stay on campus can, but it allows those who would want to minimize travel to do so after many of them returning home for Thanksgiving. Another question, and it's based on
Hey, Rod.
Yes, please, Bruce.
I'm sorry. Let me we agreed I would ham and egg it a little here, and I apologize for interrupting you. The one thing we heard over and over again from a number of our students was that they now have summer internships or summer jobs. And so moving the start of class up a week or two just seemed to be incredibly economically disruptive to some. And therefore, we thought we could do better by leaving the date exactly where it always has been, and then being more flexible on the back end of the fall semester. So this is part of our flexibility here, but also trying to make sure we give every possible accommodation to every portion of our community as we can. So that was a key factor. Excuse me, I'll let you go.
Thank you, Bruce. And from a logistic perspective, there's no doubt there's a lot to do between now and the beginning of the semester when 30,000 students come back. And I do recall back to the flood of 2008. There was a great deal to do before the students, the largest class in the history of the university, would come back in the fall of 2008. We needed every minute. Now, I don't know if we'll need every minute, but I know from a facilities perspective, to get these buildings ready, to simply truncate the break by 2 weeks is also a logistical challenge. So we believe it's the right thing to do in controlling and giving options to reduce travel after Thanksgiving, but keep the semester as we have it planned. Why is the university requiring masks? This is something the CIMT has had a great deal of discussion about and has received both feedback and information from others on this front. As the bullets below that say, wearing a mask protects the health of your colleagues and your classmate, and it serves as a source control. We want to create an environment that is the safest and most sensitive to our neighbor. And this goes back to some of what Bruce said about the balance of providing a campus that is as safe as it can be, as healthy as it can be, but also recognizing that balance includes a social commitment to our neighbors. We don't know if the person walking by us or sitting next to us might be going home to take care of somebody who is in a condition that is much more sensitive than I or you might be facing. And we want to both show and actually display and do as much as we can for our neighbor. And one of the things we don't want to do is make it less than an expectation for our community. So it's obviously a good question and one that has been talked about a great deal. But we feel it important going into the fall semester to require masks for interior building, encourage that for exterior settings, but require it for interior until one is in their office or in a room alone. If I'm on campus right now and my mask is right there, but I'm in my room. So once I leave my room, it's incumbent upon me to have my mask on. Will the university refund part of my tuition? A common question, and obviously the questions of refunds that came up in the spring semester will continue to, if there's any kind of changed format to the way we teach and the experiences of our students. As it says, no, the full tuition is necessary for covering ongoing operations, including retention of our faculty and staff needed to provide that instruction and the student support. It's the cost of education. And one of the things we have learned in the spring is through difficulties and challenges and extra hard work by our faculty and those supporting our faculty is that teaching can be done virtually. We are good at it and we will be better at it. But that's also part of the reason why we're having a semester on this campus, which is what Bruce spoke to. We know students and their families are anxious to get back to the campus, and we want to make sure we offer that. On the next page, a few more questions to round this out. What is the university doing for testing and contact tracing? As it says, the university is still developing. We're still discussing, working with our medical experts that are on the CIMT, Dr. Paul Natbig, Dr. Dan Fick, who have been invaluable members of our team and really doing so much work on our behalf and bringing that expertise each day on these fronts. But as it says, we will be developing plan for testing, but everyone who is symptomatic will be able to be tested and will be tested. So these are important measures. We know we're keeping track also of what other institutions are doing, looking at best practice opportunities, but also realistic ones. The contact tracing will be coordinated by Johnson County Public Health, and we will be working with them on that front. Is the university going to go online for the spring semester? No doubt both we and other institutions are looking not just at the short term, but what happens in the long term and where do we stand? People worry about the flu curve and when that introduces and where will we be with either second or third waves if that happens with COVID, and a vaccine and medicines. A very unpredictable future at this point, but the university does at this point plans to have face-to-face, but we will, as we are through all of this, remaining flexible and will respond to what we find with COVID as we move forward with the severity. We'll remain ready. We will continually evaluate backup options as we go into, through, and beyond the fall semester. And then why is the university having these virtual updates, one like today? This one, the first of 10 sessions we will have, and it's important. Our strategic communications team has been, and I would hope that you've been partaking in these as they've been offered, have been providing weekly and sometimes more than weekly updates on COVID and where things are standing. We have tried to remain as constant in public communications and consistent in public communications as we can, but also as we get to those questions of what is next and where do we stand, we want to expand our communications, and this is one of the ways to do that. So we want to make sure that all of you have a chance to plug in, whether it's to all 10 of these, whether it's to some of them or the ones that that most interest you or most concern you and your coworkers or fellow students. They will be recorded so that you can access them. But we want to make this another level of communication to make sure that our institution is taking communication in this, no doubt, very testing, confusing, and unpredictable state of our country and higher education we want to do as much as we can on that front. And to that end, I do want to briefly summarize the forum events that are on their way. We will be sending this information out. We have and will be sending it out, but just to make sure here that you're understanding of these. Tomorrow, we will have another one of these sessions. Again, Bruce will kick it off. I will host it. It'll go through the same slides. That will be at 10 o'clock in the morning for those who may not have been able to partake or listen into today's forum. The next one we will have will be, again, a 1-2-day punch, July 1st at 10 o'clock in the morning, followed by July 2nd from 1 o'clock to 2 o'clock in the afternoon. That subject on July 1st and 2nd will be academics in the classroom. Provost Montse Fuentes, Kevin Kriegel, who not only with the Provost's office, but also the planning section chief for the CIMT, and Tanya Uden-Holman will be hosting that set of two shows and displays of the information related to academics and classroom. On July 8th from 2 o'clock to 3 o'clock, and July 9th from 10 o'clock till 11 o'clock in the morning, we will be having a session on the student experience. The folks that will be leading that presentation will be our Vice President for Student Life, Sarah Hansen, and also Angie Reams, Dean of Students, and she is also the section chief for our logistics team on the CIMT. On July 15th and 16th, we will be hosting a session on human resources and the support of our employees. Cheryl Reardon, the chief of our operations section for the CIMT and head of HR for the university, along with Joni Troyster, who's the deputy chief and has been also really involved on the CIMT work that we've been doing. And the final of these 5 sessions, 2 each, will be on July 22nd and July 23rd. The subject will be research and our campus research, led by Marty Schultz, our Vice President for Research, Haley Sin, Director of Environmental Health and Safety, and Debbie Zumba, who is the Assistant Vice President, Director of Business Services, and so central to the supplies we have both for research and for, frankly, our entire campus. So those are the sessions coming up. With that, I will wrap it up. We're about 15 minutes ahead. I don't know if there are from those who are on the line, Bruce or Dr. Paul Natvig, if there are any additional comments, but we also don't want to take up your time just to take up your time. We want to make sure you have the information that we have. And once again, offer both a thank you and an encouragement to remain kind to your neighbor on the University of Iowa campus and in our community. It is a stressful time. People who have been working from home have been trying to and have been getting used to that environment, and it will continue to be a challenge. And we so appreciate those challenges. And as you will hear, and we don't want you to wait for the human resources and supportive employees, don't let stresses continue to build for you. If you need to talk to your supervisor, talk to your HR representative or representatives, and let's make sure that you're receiving what you need to do your job effectively, but also with a certain amount of peace in this very unsure time. We appreciate it so much. And with that, I will wrap up, see if there's anything else, any comments others may have. Bruce?
Hey, Rod, again, this is Bruce. I apologize. But it occurs to me, one thing we didn't mention, it will get covered in a future session, but some of you may be wondering this issue of wearing masks and how we change some of the behaviors. Excuse me. How will the students come along? And I will just simply say they have to come along so we can keep everybody, the whole campus safe. Simultaneous to these sessions, we've already run, I think we ran it on Monday. What day is today? Wednesday. But we're running similar sessions focused on the students and what we're expecting of them. There are multiple training sessions that will take place between here and the start of classes with all of us in different formats and in different ways. I think Angie Reams and Sarah Hansen ran one on Monday for students. And yes, we do expect all of us, it's the new set of behaviors. If we get, typically the the flu does spike in the early, I don't know what early is, in the February, March timeframe for Iowa. So all the precautions we're talking about as to what we're doing the fall semester are really important, but they could really also be really important as we get into the spring semester. And the way in which we change our behaviors now may really enable us to be successful in the spring. So,
yeah, Bruce, one
and
more
again,
thing I'll add with
yeah,
the masks. I know some of you who may have either traveled or been to other communities, or maybe even in parts of our community, and see evidence of, you know, a lot of people without masks. And we see in the news recently more and more evidence that the masks are an important part of the system of us trying to remain a healthy community. I can tell you that the Iowa City leaders and Iowa City downtown business folks are beginning a campaign on this front and asking us to participate, which we certainly will. It can't, nor do I think it should be just part of or a charge by the University of Iowa, but by our community. And we can all live by example and expect that of our entire University of Iowa community. And that speaks to what Bruce, you're talking about. And so with that, I will go ahead and end today's session. Again, we'll have another one of these with the same slideshow. We'll continue to respond to questions that may come up and continue to refine these as we go. But this is the first of 10, and we appreciate your time and all of your efforts. Thank you so much.
here, here. Thank you.